Looks like we have just completed the dial through to everyone in British Columbia, so I think we can now get down to the business at hand. So before we continue, I just want to acknowledge that those of us here at the HSA head office are joining the meeting today from the traditional and unceded lands of the Kwantlen First Nation, which shared its land with the peoples of the Kakite First Nation in what we now know as New Westminster. We're grateful to the traditional stewards of the lands across the province and for their role in caretaking and fighting for the land from which we all benefit. Now, for those of us who just joined us a few minutes ago, welcome to this, which is the first of 4 telephone town hall meetings we're having to discuss the redesign of job classifications for health science professionals in BC. It's a complicated process, and we here at HSA have been working for months to build a process that helps make this as easy as possible for as many of you as possible, and we're going to talk about that today. So leading that discussion today is Derek Wong, HSA's lead in classifications, and joining us also is Sharon Gagan, who's here from our Labor Relations Department. But I'm going to turn it over to Derek in just a second, but I'm going to remind you one more time, if you have a question that you would like to ask live to Derek, all you need to do is press *3, and you'll be taken to an operator who will help get you in position to do so, and we will start going through those questions once Derek has walked us through the high points. So without further ado, I'm going to turn it over to Derek.
Thank you very much, David, and good afternoon, HSA members in the Health Science Professionals Collective Agreement. My name is Derek Wong. I'm the coordinator of HSA classifications, and I've been your lead negotiator for classifications discussions through the last several rounds of collective bargaining. So why are we here? You have been receiving all kinds of communications from both the union and your employer. Well, why is that? Because under the classification redesign program that was ratified in many of our recent collective agreements, including the one we ratified earlier this year, that called for the completion of a new classification system, a redesigned profile-based classification system to be implemented in our collective agreement in the 2024-2025 collective agreement year. And part of that process is making sure that every job description, your job description, is matched to the right new classification and profile so that you're paid properly in accordance with the new system when that comes online in 2024-2025. So the first step in that process, as far as what you see, is the fact that the employers, each employer was to have notified each of you, every regular full-time and regular part-time HSPBA employee, by last Friday. You should have received a notification from them that should tell you what your profile classification is in the new system in the employer's opinion. So that's the employer's view of what your profile-based match is. It isn't necessarily your view or the union's view, but that remains to be seen. So you should have received that notification last Friday or before, as well as a link or copy of your current job description. One other important piece of communication that the employer probably sent you at the same time is an email address. That email address will be used should either the union, should either HSA or yourself disagree with the profile match, and that email address of the employer is where we will send the objection form, the grievance, if you will, that will dispute the employer's claim to your profile-based classification and allow the union to take forward a case to correct it and make sure that you're classified and paid correctly. So I want to direct you, all of you, to make sure that you're opening those emails. Some of you have had our emails caught in your spam filters, so double check those. But also go to the HSA website, hsabc.org. So when you go there, one of the first things you'll see right at the top center of the page is that thing that scrolls by with all of the big news that's going on right now. And one of them is the classification review. So click the classification review, and that takes you to a brief overview page telling you a little bit of the history of how we've got to this point and why we're going that point and why it matters. And very importantly after that is what do I, an HSA member, need to do now that I've received these notifications? And the simple answer to that is click the classification review tool link. It's in a big red rectangle right on the page, so it's easy to find. Click the red rectangle classification review tool. You need to do this if you want to be assured that your profile-based classification has been assigned correctly by the employer. You need to click the link for our classifications review tool prior to November the 15th. So you have a bit of time. You have till November 15th to consider your job description and the information that the employer has sent you. By the way, the employer sent you a lot of other information, FAQs, and links to know more about the classification system. HSA, of course, can't see those because those are on the employer's intranet systems. We certainly recommend that you go to our website, hsabc.org, click the classifications review links to look at the materials there, because while the employer's information, I'm sure, isn't accurate, it's designed for the employers. It's designed for the managers and the HR folks. It's not designed for union members. It's not designed for employees in your professions. So I encourage you to go to the hsabc.org website. So I'm going to go over briefly why we're doing this. Well, because you, the membership of HSA, have been telling us we need a new classification system for a long time. The first time the collective agreement included a memorandum to form a classification committee province-wide to create the new system. That first occurred in the 2006 to 2010 collective agreement. And the employers were on board with the idea. They signed that memorandum, and they also would like to see a new classification system. But why do we need a new classification system, many of you will be asking? Because when HSA was first formed, we had about 10, 12 professions. And then we didn't create a system, we negotiated classifications of pay rates that made sense for those 12 professions. And we didn't do it in the same way because we just did what, well, best served the professions at that time. Well, since the beginnings of HSA, which is 50 years and more, we've now expanded, we've grown. Health sciences have become an important part of the healthcare team in ways that no one could ever have imagined. And now we have over 60 professions and classifications in the collective agreement. But we negotiated them in, rather than in a systemic way, as the needs fit for each of those professions as they entered the collective agreement. So now we're at a point today in 2023 where we have over 60 professions, but some of them have as few as one classification and one pay rate, while other professions have several dozen classifications and 8 pay rates. And the ability to move through pay rates and classifications for different jobs in our professions varies so very much between the various professions. So that's what we're looking to change. That's what everybody has been saying needs to change since 2006. So we're going to a new profile-based system. Profile is just the word for the document or descriptor of types of work. So those are called profiles. So that'll be the name of your classification. And there are now going to be 11 of them in 2024, 2025. And those 11 profiles, those 11 classifications, will apply in the exact same way to every profession. So we have achieved fairness and equality in terms of classification recognition for all professions with the bringing in of this new classification system. Another very important piece of the early days of the classification work in the collective agreement happened during that discussion in 2006 to 2010, and that resulted in a memorandum of agreement, which now appears as Appendix 23 in our collective agreement, and that was signed off and ratified by you and the employers in the 2010 collective agreement. And that agreement created the starting point, the linchpin, if you will, for the new classification system. And it contemplated that what has been up till now been described as a staff level or grade 1 level of work. The parties recognized, the employers did, and the membership did, that every day for just about all of our professions, grade 1 and staff level was being asked to do more and more. The complexity, the acuity was growing, as was the technology and the techniques being used by day-to-day workers in all our grade 1 and staff level jobs. And it was becoming more and more like grade 2, and certainly appeared to be deserving of that kind of recognition in the collective agreement. Grade 2, including types of work like working without general supervision and sole charge and student supervision. So it was agreed in the 2010 agreement, and ever since, we've ratified it over and over again, including last January, February, that the new classification system will include a new working level professional classification, which today we call P1. All of you who are in those staff level and grade 1 positions have been seeing already the pay increases associated with the implementation of P1, because the 2010 agreement says not only should we create this bigger, broader, more significantly recognized working level of P1, but that it would be paid at the higher of those two rates. It would be paid at the grade 2 level or the sole charge level in those professions that aren't named with grades. So already we've seen that improvement. We saw the first piece of that implementation of P1, 1/3 of the pay lift happened in 2022, and the 2/3 of that pay lift happened this past April in this year of 2023. So that's P1, that's where we've been, that's what we've set out to do, and we're accomplishing as we speak. So now it's time to look at not only the P1 job descriptions, but all of them to see where they fit in this brand new profile-based system that we're bringing in. Now, we've designed, and I've mentioned before, this classification review tool. Really, all you need to know as an HSA member in the HSPBA Bargaining Association collective agreement is to use the classification review tool with that employer notification of your profile match in hand. The classification review tool will verify your HSA membership so that we're protecting your privacy in terms of exchange of information and providing you with advice. So have your personal email address that you registered with HSA and go on to our classification review tool. Some members have had a few glitches with accessing the tool. That may be because they've misremembered which email address they provided to HSA. So check your email addresses, try all of them until you get through. But if that doesn't work, please email us at redesign@hsabc.org, redesign@hsabc.org, and we will assist you to get through to the tool. So for those folks who are having those email glitches in getting through to the tool, bear in mind that we have to verify through the information we have through dues collection and seniority lists that you're actually our member before we create an identity on our system for you. So that could take a couple of business days, especially since we're really busy. You know, there's 10, 20,000 of you involved in the process at this time. So give that a few days grace. So don't wait to the last minute. Don't wait till November 15th to use the tool. And so please take that advice and make sure you're opening our information, reading our FAQs, and starting to use the tool as soon as you can. So I just mentioned our FAQs. At the bottom of our webpage, which has all of that redesign information, are our frequently asked questions. Please click the link because it, well, we hope, has anticipated all the questions that HSA members have about this, about the redesign and this process. It's divided into 3 sections: general questions, frequently asked questions about the system itself, and what happens in terms of these objections where we think possibly that the employer's got it wrong with our profile-based match. Well, how would you know if you got it wrong? Well, there is, again, the tool will ask you simple questions like, do you supervise other staff? Are you performing special procedures? We're not asking fancy classification questions. We're simply asking you what you do. What is the main purpose of your job? What are the significant pieces of your work? So that's really all you need to know. Have that information in hand, use the tool. For those who really want to understand all the new classification system levels, classifications, pay levels, there is a frequently asked question which is entitled, what are the new classification levels and what do they mean? If you click there, you'll get all the information you could possibly want. I'll just very briefly go over that so that you have that idea in your minds as we move on to questions. And again, click *3 if you want to get in the queue to ask a question. We already have several members that are lined up and ready to go with some questions about the new profile-based system. So I've mentioned P1. All of the working level classifications profiles are called P for professional. So there's P1, which encompasses the current grade 1 and staff level, as you know, together with much of what is currently in grade 2 and the sole charge level. Above P1 are 6 P2 classifications. These are advanced working level professional classifications, P2. The first type is called P2A. Very simply, that's what we call special procedures today, which is available to several of our professions. For the purposes of the job matching process, you'll know if you're P2A because you're currently being paid at the grade 3 special procedures rates. Everyone else, P2A isn't available to you yet. When the system goes live in 2024, other professions will have access to P2A, which we've expanded and now call it special procedures and techniques. And it requires that you have a higher level of education and training and experience in a specialized practice or procedure within your profession. For those of you who think that they're doing something like that, an advanced piece of practice or procedure that hasn't currently been recognized as a special procedure, see our FAQ about special procedures. It'll provide you with the definition that needs to be considered to get us there, and we'll encourage you to provide that information to HSA. There's an email address right there in the FAQ on special procedures and techniques. And when the system goes live in 2024, 2025, HSA will use the mechanisms within the new system to advance the argument that those things should be recognized as P2A and get them added to the list that you would see in the profile. So that's P2A. Those are for folks who are doing advanced level work directly with patients and clients. Then there's 5 classifications that are called P2B. These folks, their primary responsibility is not, strictly speaking, on their own patients and clients, but it's supporting their colleagues, the programs, the departments, on a more systemic level. These 5 classifications of P2B are P2BE, educators. These folks are responsible for clinical education and student training programs. This is not mentoring a practicum student who's working beside you on the shift. P2BE is about the person who liaises with the university, designs the practicum rotations, makes sure that all of the folks that are coming in on the practicums are receiving the training, sometimes doing actual teaching, and making sure all of that clinical placement program runs the way it should, and we have new health science professionals coming to join us on the front lines. They're also responsible in many cases for clinical education of their colleagues, positions that are today in many departments called clinical educators. That's P2BE. P2BS are clinical specialists, S for specialists, and they're also technical specialists. These folks design procedures, protocols, standard operating procedures, consult to members of their own profession, providing specialized clinical advice and consultation in specialized areas of practice within your profession. Their focus isn't on delivering care, but it's on facilitating the delivery of care by their colleagues. P2BI are information systems health science professional specialists. We have several professions that have a very complex and overarching information system that interfaces with the clinical function. Things like the PACS administrators in medical imaging or lab information specialists or clinical pharmacy information specialists. So those are P2BI. And then there's P2BQ, quality control and quality assurance program specialists. The P2BQs, these folks are responsible for the quality assurance program, designing it, make sure DAP standards are being met, making sure that all their colleagues are aware of what the standard procedures are and adequately trained and supported to do quality assurance. This is not the quality assurance or quality control procedures that many of our P1 or grade 1 folks today perform when they start a shift. It's not that. These are the folks responsible for the entirety of the program. And lastly, there's P2BR, which are research and development programs and activities. Unfortunately, there aren't a lot of these nowadays because, of course, we have our shortages and they're trying to hire enough of us to do the work and make sure patient needs are being taken care of. Hopefully that's something that we have more of in the future, P2BR. So those are all the working level professional classifications of P1 and P2. Lastly, and certainly not least, we have our supervisory and leadership classifications. Those profiles are labeled with the letter S for supervisor. Supervisory leadership has 4 levels, S1, S2, S3, and S4. And we're doing something a little bit different in the new profile-based system. 1, 2, 3, 4 is about the quality and complexity of work being performed in a supervisor's work group or department, and is not FTE-based. It's who you're supervising and what they're doing that moves you between S1, 2, 3, and 4. And then within those 4 profiles, there are 4 FTE groupings. So there are 4 pay levels for S1, and again, 4 pay levels for S2, and S3, and S4. As many of you will know, depending on what profession you're in, the FTE numbers, or the number of staff you supervise as a supervisor, creates very different outcomes in terms of grade level or classification and pay level. That inconsistency between supervisors of our professions is being removed in the new system. The FTE groupings are by multiples of 8. So the first grouping, or the first pay level for all supervisory classifications, are those who supervise up to 8 full-time equivalent staff. And then the next is between 8 and up to 16, and then between 16 and up to 24. And lastly, the larger departments and work groups of over 24 FTEs. So those are the 4 FTE groupings. So what about the 4 S levels? Well, S1 are supervisors who supervise only staff who are non-health science professionals. They're supervising HEU support staff in the hospitals or community health collective agreement staff in some of our community-based programs and workplaces. So that's S1, folks who supervise non-health science professionals. Then there's S2, which is the majority of our supervisors in the health science professional collective agreement. These folks supervise P1 professionals, the working level health science professionals of their profession. And they can also supervise, of course, the S1 supervisors, and they further can supervise the P2A special procedures and techniques folks. All of that together is S2, supervisory level 2. And again, all of this is on the website. I know I'm going fast so I can get to your questions, but that's S2, which is our primary supervisory classification. Next is S3. S3s have usually larger departments. They supervise everybody that an S2 can supervise, and they can supervise S2s as well. In fact, they must either supervise an S2 or one of those P2B systemic advanced level working professional positions. So S3s supervise S2s and P2Bs, and more. And lastly, S4, which supervises NS3. So these are the folks who are PPLs of our largest departments and programs and workplaces. And that's the entire classification system. So I'll leave it at that so we can go to questions. Again, you need to click *3 to get in the queue to ask a question. And please, 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 there's so much information that I could be passing on to you. Look at our website. The FAQs there are quite robust. I think that you'll find just about every question you can think of answered in the FAQs. But should there not be an FAQ to address your question, please email us at redesign@hsabc.org. Redesign@hsabc.org. And I think, David, we're ready for questions.